Hello everyone, my name is Maria. Welcome back to my YouTube channel, or welcome to my YouTube channel where we are talking about lichen sclerosus, an autoimmune disease which causes a lot of stress and pain in the life of its bearers. So today's video's topic is very sensitive for all of us who have lichen sclerosus. Will it go cancerous? As you know, most of the doctors believe that only 5% of all the cases of lichen sclerosus which were detected, I want to underscore this word, detected. So only 5% went cancerous. But still doctors are not very sure that there is actually a connection between lichen sclerosus and vulvar cancer. There are not enough studies in this area, unfortunately, because lichen sclerosus unfortunately is not that type of disease in which studies rich people want to invest a lot of money. Another problem is most of the doctors confuse one diagnosis to another. That's why we have a lot of misinterpretations around lichen sclerosus. Anyway, 5% of all the cases, it's not little. What can we do to prevent lichen sclerosus to go cancerous if there is actually a connection between lichen sclerosus and vulvar cancer? First of all, we have to talk about how vulvar cancer manifests itself. The most common is vulvar carcinoma. So let's talk about how vulvar cancer can look like. The typical symptoms can include lump or bump in your genital area, which can be red, pink, white, slightly black, and which can be covered with something similar to wart. The vulva area can look different from its normal appearance. It can be lighter or darker, and the skin can be inflamed, so it can be reddish or pinkish. The surface of the skin or this lump or bump can be rough, thick. It can remind of cauliflower. So basically the skin changes the texture and the color. Also, there can be ulcers, and especially you have to pay attention to those ulcers that are staying there for more than 7 days despite the treatment you give them. And of course our favorite symptoms are itching, burning, like in lichen sclerosus. Vulvar cancer can involve discharge or bleeding, which is not normal if you don't have periods. I have to say that vulvar cancer can be treated the most efficiently if spotted early. So what can a person do to spot it early? Of course, go to biopsy, because the biopsy is the most efficient test that can positively identify the disease you have. The earlier you feel the changes in your skin and the earlier you do the biopsy, the best for you. Vulvar cancer can go outside vulva. On some not so early stages, it can affect urethra, anus, and vagina inside. It can spread to the nearby lymph nodes, and on the very late stages, it can also spread to the lymph nodes all over the body. You definitely don't want that. So as you see, this condition can be very, very serious. Your task is to prevent this from happening. In conclusion, let me tell you once again, the connection between lichen sclerosus and vulvar cancer is not yet proved, but still the doctors have all the right to believe that untreated lichen sclerosus or lichen planus can lead to vulvar cancer. Also, I'd like to say a word about who is at risk, because there are a lot of different people having lichen sclerosus, and lichen sclerosus can manifest itself even without any symptoms at all. So who is in the risk zone? Well, first of all, those who have this cancer inherited conditions. So if some of your relatives already had cancer, especially skin cancer, then you can be at risk. You have to monitor your condition every year, or preferably every half a year. And as I said earlier, vulvar cancer, if spotted early, can be stopped on its tracks, and you can live your normal life after that. Also, at risk are people who already had some malignant formation on their skin, especially if it concerns birthmarks. Everybody else who have lichen sclerosus, have to be very careful and regularly see the doctor to see the difference and the changes in the skin texture. I also recommend you, if you have an opportunity to look in the mirror or to take some pictures just for yourself, take it every half a year. Thus, you can easily spot any changes. This is all for today. Thank you for watching this video. I hope you got some new information and support. Please subscribe to see all the new videos on my channel. Stay safe and take care of yourself. Bye!